too? Or?
Yeah.
Oh, okay.
Mm-hmm.
Okay.
Both
So
of them.
English, and then we're gonna transition to Spanish.
To Spanish. Good morning. Good morning, Aurora. I was going to say in Spanish because I'm always in Spanish version, by the way. So today I got the English version too with Dr. Jonathan Waxman. So tell us a little bit about you, doctor.
Sure. Thank you very much for having me here. I appreciate that. I'm Dr. Waxman. I'm a thoracic surgeon, and I deal mostly with lung cancer. I'm currently the chief of thoracic surgery at Copley, MD Anderson,
Mm-hmm.
and I look forward to talking about this important disease. Thank you again.
No, no, you're welcome. Thank you for coming out and showing us and educating us a little bit of the topic. I know that there's a lot of people that, like for instance, we don't know, right? That cancer, we understand like, oh, it's a bad disease, but obviously we don't really get to see it every day like you do it, right?
Correct. So, unfortunately, lung cancer is the number one cancer killer in the United States, accounting for both men and women. Uh, November is Lung Cancer Awareness Month, and one of our goals is to try to raise and spread awareness about this very lethal disease. Again, it's called or referred to as a silent killer because by the time people develop symptoms, it's usually caught at a very late stage where the chance for meaningful treatment or cure is low. However, we're very lucky that we now have a screening test for lung cancer, which is called a low dose CT scan.
And are those tests doing like in a regular checkup from like if I go for a physical, or is it more like, hey, we saw something in your physical, now we're gonna send you to a specialist?
That is a great question. So usually it falls on the hands of the primary care doctor to identify which patients are at high risk of developing lung cancer. And when those patients are identified, then they can undergo one of these low dose screening CT scans. The patients that we try to identify as high risk are considered to be patients between the age of 50 and 80, patients who are currently smokers or have quit within the past 15 years, patients that have a 20 pack per year smoking history. So in order to figure at least 20 pack a year, so in order to figure that number, we take the number of packs and multiply by the number of years the patient has smoked, and that's how we come with that number. And and very importantly, also patients that don't have any symptoms at the time. So those are the patients that are considered high risk. And once these are identified, the primary care doctor, after having a discussion with the patient, can go ahead and order this low dose CT scan.
Okay, and that's when then you guys get to see a little bit more of the lungs and see if they're normal, abnormal, or if they have something, correct?
That is correct. So, if you don't mind, I'd like to tell you a little bit about what this low dose CT scan is. So, it is actually a very quick and very easy imaging test. It's a CT scan, as we just mentioned. There's no needles involved, there's no IV contrast. The scan itself takes only a few seconds, so it's completely painless. So when the patients have that scan, they go inside the CT scanner, and again, they just go in and out, and within seconds, we obtain these images of the thorax, the chest, which includes the lungs. And then we can look for abnormalities, even very small abnormalities. And based on those results, we can grade those abnormalities as depending on how suspicious they look. And depending on what that finding is, if somebody who meets criteria for these low dose scans, if they have a scan and the scan doesn't show any obvious abnormality, the recommendation is to continue scans once a year, at least probably until the age of 80. If the scans do show an abnormality, depending on what that abnormality looks like, then there will be some discussion with the patient and other specialists to determine what the next best course of action would be.
Maybe. And like you were saying, is it the best time to start those kind of tests when you're 50, or if you already know that you're a smoker, that would be something that would be, hey, I'm gonna start going to my doctor at 40s. What are the ages, not the best ages, right, to go and see the doctor, but most likely that you will see that you need to go and get checked out
Sure.
from?
That's a great question too. So I think it's very important to talk about what are those risk factors that will alert or identify somebody as a high risk. As I just mentioned, the factors that we look for that will identify somebody as a high risk are those that we talked about, being between the ages of 50 and 80, current or former smokers that have quit within the past 15 years, the pack a year history, and the absence of symptoms. But that doesn't mean that if you don't have those risk factors, you're okay. There's other risk factors that we have identified. Those include the exposure to radon, which is a colorless, odorless gas that lingers particularly in basements. Family history and genetics are very important. So somebody who has direct relatives with lung cancer also has a risk of lung cancer. Some occupational hazards or exposures, people that work with asbestos particularly, we know that that is a known risk factor, and other types of lung diseases. So that's why it's very important to have a conversation with the primary care doctor to identify those risk factors as well. If somebody has those factors, even though they might not be labeled or considered a high risk, they could undergo one of these low-dose CT scans to try to see if there's any abnormality.
And like you were saying, right, on the CT scans, they're on this level of tests, it doesn't hurt that person. It's not like, oh, it's gonna pinch me or do anything like that, like taking any blood or anything like that, right?
Absolutely, it's probably the easiest test. Again, there's no needles involved. There's no dyes involved. There's it's just laying on a little platform or bed and going through the machine. And again, the scan only takes 10 seconds at best, and the amount of information that we get from it is extremely valuable. So.
That's good to know, because for instance, if I'm a patient, I want to know if it's going to be painful, at least so I can get mentally ready when it comes to the tests. You know, like that way I can be like, hey, I'm gonna go through a little bit of pain, or it's just gonna be a couple 10 seconds or 10 minutes that I'm gonna take in there and just laying in the table. I know that some people will be scared to take some CT scans, because the thing that happens is that you're gonna be just by yourself and they're claustrophobic. So how you run to those patients?
Yeah, there's obviously that's a normal concern and a normal fear, but really it's as easy as it gets in terms of having this scan. The important thing is to encourage people to have these scans and have, again, this conversation with the primary care doctors. And it's very important because the reason why it's important, again, to talk about this is because this is the only tool that we have available to help us detect lung cancer at an early stage. And this is the only time where, if detected early, we can actually aim for cure. Again, once the cancer is advanced, the chances for cure decrease significantly. The challenge is that lung cancer at early stages is usually asymptomatic. People may have an early stage lung cancer and don't know about it until it grows and it advances to a higher stage where symptoms start to occur, and by then it might be too late. So I think it is important to talk about what are those symptoms. So we're talking about cough or coughing up blood, fatigue and weight loss, chest pain or shoulder pain, things that may look like a regular cold or a non-specific lung problem. Those can be also symptoms of lung cancer. And again, we're trying to avoid diagnosing it once those symptoms begin. So that's why lung screening helps us identify it at an early stage when it can be cured.
And that's really good to know what are the symptoms, right? Because, for instance, I will think that they're normal. Like, oh, I have a normal pain, or I have a normal cold. But then you will get to see the doctor, and that's when the doctor has to make that decision, right?
Correct. That's why, again, it's considered a silent killer. So I think it's very appropriate during November, which is Lung Cancer Awareness Month, to try to raise, awareness and make people aware of how bad a disease lung cancer is. But on the positive side, we have now the means and the opportunity to detect it at an earlier stage and then prevent all these, I want to say, unnecessary deaths.
Yeah, and with that, you answered my first question too. Why is the topic of lung cancer so important?
Absolutely.
Yeah.
It doesn't matter. Lung cancer doesn't discriminate between race or age, or socioeconomic level. So it's very important to be aware of this. And to raise awareness, I think the best thing that we can do during November, Lung Cancer Awareness Month, and pretty much any other day, week, or month, is to help each other. So if anybody smokes or has a friend that smokes, talk about it. Also, don't be afraid to talk about it with your primary care doctor and ask if somebody is a candidate for one of these screening tests. And again, just have a direct and open conversation.
And I really like the way that you were saying too, that it's not just for people that they smoke, because a lot of us will be thinking, hey, it's just people that they smoke. I don't smoke, so I'm okay. But the fact that radon, right? And that the fact that we have also people that they work on construction and they have those chemicals too, that makes it to be a little bit more risk, right? And sometimes we don't even know, but also the air that we are now smelling and all of that can also have chemicals that we don't even be aware of it.
Absolutely. Pollution is also a risk factor, a potential risk factor for lung cancer. Yeah, you're absolutely right. There's many other risks that can cause lung cancer. So it's very, very important to be aware, to be cognizant of this. Currently, insurance, Medicare will pay for a lung cancer screening test for those patients who qualify as high risk. But for those patients who may not necessarily have these high risk factors, but may have other risk factors or simply are concerned, fortunately, the test, even though it would be a self-pay, is not that expensive or relatively expensive. We're very lucky that Roche and its various facilities offer that testing for a very small fee. And the next question is going to be, where can those patients undergo that screening test? Well, we have many facilities in Roche, downtown, Oak Park, Naperville, Lisle, Oak Brook, Aurora, Yorkville. So there's many facilities that offer these tests.
Do you guys offer tests also in the city, or just people from the city, they will have to come here? Everywhere, because I know that there's like a Rush hospital in the city, right?
Yes, and Rush downtown, correct. Yes, we offer that test as well over there. But again, as mentioned, we can do it here in our community.
In our community. And that's great to know, because sometimes we don't understand that part where we see that, hey, we can get help from our community here as well. And that's one of the things that once I go to the city, I always talk about Aurora, how we come in a more empowered community to help each other, to understand. And this is one of the things that I love to do, is that once I do these interviews, it's more for educating person, right? To educate them. Because like I say, I do not understand, right? I'm more like, hey, tell me more, have that conversation with me so I can educate myself more of what is the lung cancer. I will know, right? The name says it right there, but at the same time, what are the symptoms? Where can I go? How can I find out about this? Who is the doctor that I can talk to if this happens, right?
Correct.
So those are really good topics to talk about. One of the things too that it says here. So we did talk more. I mean, our conversation has been more fluent, right? All of the questions most likely we're kind of answering right now. Um, you did talk about, can anyone get a lung screen cancer, the screen process of it? You did say yes, and not anyone, but most likely people that are at risk.
Correct. I think another question that is asked frequently is what can people do to try to decrease the risk of lung cancer? Well, I think the most important thing is to quit smoking. I think that's by far the number one factor. And in addition to that, then following a healthy lifestyle, adequate nutrition, exercise, all those things that we associate with healthy living as well. But definitely quitting smoking is the number one intervention that people can do to try to decrease the risk of lung cancer.
So I'm going to ask you a question that most likely I already know the answer, but I want to ask it because most of the people, when I tell them you're smoking, that's still smoking, when they vape. Sure. Right? They're not, it's not smoking, it's vaping.
Correct. That's a great question, especially in this day and age. I think there's a misconception that vaping is a healthy alternative to smoking. Unfortunately, that doesn't seem to be the case. There's more and more data out there showing how vaping can still cause problems with breathing, problems with the lung cancer, and it's very, very important to be aware of this. As it's not a healthy alternative or a healthier alternative to smoking necessarily.
Yeah, and like I said, that was a good question too, because like a lot of my friends are like, oh, I'm not smoking, I'm vaping, but I'm like, that's still, a risk for you to get cancer. A risk that we don't know yet because this is something new, and we will not see this or what kind of risk we're getting into it in probably 10 or 20 years more.
Absolutely.
Right.
And if you think about it, some people might start vaping even at an earlier age than people who start smoking for various reasons. But nevertheless, I think that it shouldn't be viewed as a healthier or a healthier alternative to smoking. And again, it's an opportunity for everybody to, help each other and try to raise awareness about this, because unfortunately, lung cancer can affect anybody.
Yeah, and one of the things that I have heard, right, maybe you can educate me a little bit about that too, is that when people smoke, it's because they have like a problem with trying to develop that anxiety, right? They get with work, with being stressful, all of that. They say that when you smoke, is like basically releasing some of that stress.
Well, yes. I mean, with any situation of anxiety, stress, etc. The challenge with smoking cigarettes is that one of the ingredients in these cigarettes is nicotine, and that causes an addiction. And the body needs more and more of this, so it becomes a vicious cycle where people crave it, and then they continue to smoke or find ways to meet this crave, either by using cigarettes or using electronic cigarettes or these vaping devices, etc. So yes, it's a problem for sure.
Yeah, and we just want to make sure that we make this awareness, because also for our young people, right, that they're more tentative to the vaping. It's something that you have to take care of your health. It's really important. I noticed that once you start taking care of your health since you're young, then we're gonna be okay once we get older, right? And we're gonna be able to retire in an okay condition. We're not saying excellent condition. We're saying an okay condition, because once we get to that age, I have getting to know a little bit more of like the science of getting healthy, eating. And I think one of the biggest things that you were saying, eating is something that is going to affect us too.
Absolutely.
Right.
I just want to touch back on the point of smoking cessation, and there's many ways for people to try to people who want to quit to obtain help and resources. The Illinois Tobacco Quit Line, smokefree.gov is another resource. Roche has a virtual smoking cessation group, so they can call the Roche Prevention Center as well. The telephone number is 312-942-3133, and somebody can help on the other end of the line.
Okay, perfect. Do you want to repeat it one more time? So the phone number and then the website?
Absolutely. It's the Roche Prevention Center. The number is 312-942-3133. And it's a virtual smoking cessation group.
Okay. Oh, so they just virtually get
Correct.
together.
They don't have to be. They don't have to drive anywhere. They can just do it from the convenience of home, the car, workplace, wherever
they
people
are.
Yep.
Yeah. No, that's good to know, because it's also try to help them, right? I know that if you want to quit smoking, there's a couple ways that you can do it. Call the hotline.
Nobody expects quit smoking being an easy task, but there's definitely a lot of help and a lot of resources available for sure.
Yeah, no, and that's one of the things that when you're talking about that it's not easy to quit. I have seen friends that they try and they're either craving candy, like they want to start chewing on something because they're trying to stop the craving of the nicotine.
Correct.
Right, so
yeah. It's very difficult.
It's very difficult, and they're keeping on like, oh, I just got 1 month, and then they went back, and then like, oh, I stopped for 2 months, and then they're going back. It's a difficult process. You're not by yourself. That's why we have those hotlines where you can communicate with them and talk about how you wanted to quit as well. All right, perfect. I know that we touched a lot of the basics from our questions already, but another one that it says in here, what about those who do not met this criteria, like for the scanning, or for instance, going to the doctor, and I have seen it that where the doctor says, hey, you're okay, everything's fine with you, you don't have anything, but then the following checkup, that's when they find out something. So you have to meet the criteria in order for them to do the screen test, right?
So for insurance to pay for a low dose screening CT, they have to meet the high risk criteria. But again, screening is also available for those patients that may not necessarily meet these high risk criteria based, as we talked about, on other factors like working conditions, family history, possible exposure to radon, etc. So that's why it's important to have a conversation with the primary care doctor, as he's the one that will be able to order this test for those patients that may not meet high risk criteria in a way that insurance will pay for it. They would probably have to pay out of pocket. But again, fortunately, relatively speaking, is not a very expensive test. I believe that Roche offers these tests for $139, and that includes the actual test, and that includes the interpretation by the radiologist as well. And with that result, then the patient can have another conversation with the primary care doctor based on those results.
Thank you for letting us know, because a lot of people will be thinking going to the doctor is so expensive, right? And sometimes I have noticed that it is better to ask the question, like how much it will cost.
Of course.
My insurance will cover this? If it doesn't cover, what are the other steps that I can take in order for me to take care of myself?
Of course, yes. Very important.
And so it's really important about that. And now that you talk about the scenarios, right, about what is the next step once you see something in those scans? What is the process? Do you have to sit down with the family? It's just with the patient?
Absolutely, great question. Once an abnormality is identified, depending on how suspicious the finding is, a group of doctors will review that scan. That includes usually radiologists, pulmonologists, thoracic surgeons, and other professionals. And then a decision or a recommendation will be made whether the finding is concerning but not significantly concerning and then will require repeat imaging down the road, versus if it's something more concerning, it may require an intervention such as a biopsy, or possibly going to surgery to remove the abnormality or the lesion that is found. This usually will happen in a shared decision fashion with all the doctors involved to evaluate the various options and to come up with a plan that best fits the patient's needs.
Okay. And that is something that you guys go and talk to just the patient, or do you guys try to bring, the wife or?
We talk to everybody. We talk to the patient. We talk to the patient's relatives or significant others, as we find most of the times, as with any other health-related issues, that it's best to involve the entire family, as it affects everybody, not just the patient. So yes, we talk to the patient and we talk to the significant others as well.
Yeah, because they will need that help, that support system.
Absolutely, it's important. Yes.
To have it, right? I think that that's one of the things that I have seen most of the time, that once they diagnose with cancer, it's like you have to have a team. You need to make sure that you have a support system. And I know that you have the support system, right, from the professionals, but you also have a team where you're going to go home and cry and think about all those things. Because even with cancer, you still have to maintain your possibility of being positive, but still it's probably a difficult moment for the patient.
Absolutely, it's a very difficult moment. At Roche, we offer support at various levels, or I should say at all levels, not only from a professional or medical level, but everything else outside, including support groups. So it's very important to support the patient and the patient's family, as well as everybody is going through that.
Yeah, no, and that is actually really true. I had one of my clients said he was telling me about the process, and he has cancer. So he was telling me, like, I love to talk to him, because every single time that I talk to him, it's like he's full of life, even though that it's still, like a case where he goes day by day thinking like, hey, this might be my last day, or.
Yeah.
And it's unfortunately because those are the patients that sometimes they will ask for a little bit more time.
It's unfortunate, but it's important for us to be able to send the message to our patients that if and when help is needed, that they're not going to be alone. We're going to be with them along the entire way, helping them and supporting them as well. So.
And that's one of the good things that you're saying, that Rush Copley has those teams where they support systems for the patient as well.
Yes, we have that available for sure.
And that's really good. Okay, and you did talk about where are the areas where people can go and have a CT scan, correct?
Absolutely.
Yeah, are you reduce their lung cancer risk? Is there any way for people to reduce their risk for lung cancer? We did talk about like the smoking part, but what about radium? What about that? Because I mean, that they can get it from home, right?
Absolutely, particularly in this part of the region, radon is a gas that kind of leaches from the ground. And accumulates particularly in enclosed areas like basements. And it's again, as I mentioned, it's an odorless and colorless gas, but it is associated with an increased risk for developing lung cancer. So I would encourage people to try to get their basements tested for radon. There's many ways to do that. They can either buy kits by themselves or request them from the health department. But it's important to get that tested as well.
Okay. Well, thank you so much for giving me your time today. If you had to give something to the community, what would be one of the things that you will say right now? Like, for instance, it can be the phone number or things like that where they can reach and get that help.
Thank you. First of all, thank you for giving me the opportunity to talk about this very important topic, particularly that we are in November Lung Cancer Awareness Month, and we can really make a big impact. I would encourage anybody who's listening to us and who has any further questions or concerns to reach out to their primary care doctors. They can always reach us at Copley as well, at Roche Copley, that is, sorry. We'll be more than glad to help anybody that can, that has any questions or wishes to be seen for sure.
Well, thank you so much for stopping by, and continue with us. We will have this conversation in Spanish as well, so that way our Spanish speakers are able to understand why it's important November. Thank you so much, Doctor.
Thank you very much for having me.
You're welcome. Bye-bye.
Today is our big event of the year.
Celebrate.